Infection, filariasis. Etiology, caused by a nematode worm, Wucheraria bancrofti or bancrofti. The worm lives in the main lymphatics of the abdomen and pelvis. The parasite reproduction in the lymphatics, releasing microflariae into the bloodstream. Transmission of the microflariae by the female mosquito Culex from diseased patients to others. The female mosquito sucks the blood to be used as an adhesive medium for their eggs in the water and as a feeding material for the freshly hatched weak young mosquitoes before being able to fly out of the water. Subhanallah. The disease occurs in certain areas in Egypt, Sharqiya, Giza, and Imbaba. Pathology. The worms cause severe inflammation leading to obstruction of the big lymphatics and lymphostasis. Secondary streptococcal infection, recurrent attacks of lymphangitis, uh, further lymphatic obstruction. Clinical picture, lymphostasis. The manifestations depend on the stage of the disease. Early manifestations and later manifestations. Early manifestations, lymphangitis, fever, rigors, malaise, pain in the affected limb, regional lymph node enlargement, maybe suppuration due to secondary infection, filarial funicularis with diffuse matting of the spermatic cord structures. Funiculitis means inflammation of the spermatic cord. Later manifestations, lymphatic obstruction leads to distal lymphedema, progressive thickening and hypertrophy of the skin and subcutaneous tissue, elephantiasis. Other manifestations of lymphatic obstruction depend on the site. Chylothorax in the thorax, chylous ascites in the abdomen, chylocele in the tunica vaginalis, and chyluria in the urinary system. Later manifestations, elephantiasis and chylothorax, chylous ascites, chylocele, and chyluria. Investigations. Presence of microflariae in a thick blood film taken at night. Negative results are not against diagnosis because microflariae are not likely to be found in blood films of patients less than 1 to 2 years duration, and microflariae may be prevented from reaching the bloodstream by fibrosis of the lymphatics. Presence of microflariae in fluid aspirates, and presence of adult worms in excised biopsied lymph nodes in minority of cases. Microflariae in fluid aspirate and adult worm in biopsied lymph node. Treatment: diethyl carbamazine 1 milligram per kilogram increased over 3 days to 6 milligram per kilogram daily in divided doses for 21 days. Antihistaminics for the allergic reaction caused by the release of the antigens of the destroyed microflariae. 3 to 4 courses of treatment over several months interval for resistant cases. Antibiotics for secondary streptococcal infection and specific measures for the different pathological forms like the lymphedema, the chyluria, and chylothorax. Good luck and best wishes.